for two excellent presentations. I know I have a long list of questions, but we have a lot of experts in the room. I have Senator Breslin's here. There's some other people I know that have been in the long-term care field for a long time. So I'm not going to go through my list of questions, but I do want to ask one before we turn it over to the audience. And I picked the most provocative one because it's Monday morning and I wanted to get you going. So what really is the best option in your mind? Is it to have compulsory long-term care insurance? Is it an expanded partnership program? Is it a modified version of the Class Act? Or is it one of the newer solutions that people are talking about, like longevity insurance, which is basically a form of deferred annuity that kicks in when people turn 85 or another age? So
I'll take that. Thanks, Courtney. This country has not had an adult discussion about long-term care since the late 1980s, early 1990s, when the Pepper Commission published a report. Claude Pepper was a U.S. Senator and was a congressman from Florida. He convened a commission that included a number of people who are actually still members of Congress, Jay Rockefeller, Henry Waxman, John Dingell. A number of these people were on that commission. And that commission sort of laid some of the groundwork for long-term care insurance. I would suggest that what we need here is a partnership in a sense that government ought to be able to take risk that the private sector won't take, but the private sector should be taking the risk and should be encouraged to take the risk that it should take. And I think what we need here is partly an education campaign, that we continuously survey the market and find that 60% of the people believe that Medicare pays for long-term care, not Medicaid, but Medicare, and that what happens is people can consider long-term care insurance when it's too late, when they're in a crisis stage. So we would encourage state efforts and federal government efforts to tell people to plan ahead. And we, like I said, we look at this as a partnership and want to partner with the state of New York as we have, and with the federal government as well.
Yeah, I would agree. I think that the lack of adult conversation is a good way to put it, actually. I think as the baby boomers age, you're gonna start seeing that, and we hope that we have an adult conversation. I don't think there's one option. I don't think you'll see society develop in such a way that there's only one option. I think there'll be numerous options, but I would agree with Sam that we need to have that conversation here.
I know there's got to be some good questions in the audience. I see one right there. Michelle has a microphone. So if you could just say who you are, your affiliation.
Andrew Koski, Home Care Association of New York State, and I actually have a question for Sam. With the Class Act, if it stays on the books, what are the challenges and opportunities for private long-term care insurance? Is it going to put you guys out of business? Does it create new incentives to sort of change your focus?
That's a really good question, because we have followed that debate now going back 4 or 5 years and are very much engaged in monitoring implementation in Washington. To date, Class Act has actually helped in a sense that it helps educate people about the need for long-term care. There are two components in Class Act that I think it's important to distinguish. The Class Act provides a benefit for the disabled community, and the Class Act program also looks at the long-term care community. I think it probably does a better job with the disabled community than it does with the long-term care, elder care community. And the reason I say that is the Class Act program provides a $50 a day benefit, and when you look at what the costs of care are, $50 a day barely scratches the surface for somebody who has Alzheimer's. $50 a day can probably make a real difference for somebody with a disability, and if the object is to help that person get to work, then that's a program that we need to seriously consider how to make work. Class has been subject to a lot of issues with regard to the finances. The Secretary of HHS has responsibility for making the program work. We've gone in the course of the last month and met with Kathy Greenlee, who's the Assistant Secretary for Aging, who has responsibility for making this program work. She looked at us and said, look, I've got a difficult job in front of me. I've been handed a law. I can't change the law. My job is to make the program work within what's in that law. As to whether it's workable or not, we won't know, and we probably won't know for some time.
Great question. Don't be shy in the other room as well. I don't see any hands, so I'm going to go to the one.
question. One is to please explain to me the PPA Act, the Pension Protection Act. And second is for the pre-existing conditions. And at the time when we got a long-term insurance, I actually was sick, so I couldn't get insurance at that time. Have there been any changes in the long-term care we can be extending to people with some pre-existing conditions?
All right, let's start with the pension protection. You asked me to explain the act. I can't do that. That would take 2 days. It would take a number of lawyers. I will elaborate a little bit on its impact on long-term care insurance. What the Pension Protection Act did was to provide a tax incentive that enabled payments to come out from an annuity to not be taxable income if they were used to pay for long-term care insurance or long-term care services. Today, payments coming out of an annuity are taxable income. They're taxed at current levels of income. What the Pension Protection Act said was that products that linked an annuity to a long-term care insurance policy or to pay for long-term care services directly, beginning January 1 of 2010, those payments were non-taxable. With respect to life insurance, the tax clarifications were mostly with regard to what are called 1035 exchanges, where you can exchange an existing life insurance policy or an existing annuity for a policy that incorporates long-term care in it. There had always been a mechanism for life insurance to pay for long-term care via accelerated death benefits or otherwise, but mostly it was in regard to the 1035 exchanges. With regard to pre-existing conditions, if you're asking about pre-existing conditions under the PPACA, where pre-existing conditions are removed from health insurance, long-term care is not treated as health insurance under the PPACA. So where health insurance will no longer be able to underwrite, and in many group cases didn't underwrite to begin with, long-term care insurance is not affected by the prohibitions on pre-existing conditions.
Please.
Joel Margolis, private citizen. This is a gentleman from Genworth. As you know, Metropolitan dropped out, I think because they realized they had misguessed or misestimated the costs. I mean, how confident is Genworth that it's accurately priced its cost policies?
You're asking a business question as opposed to a public policy question, and I'll answer it as best I can. That I can't comment on what another company has chosen or not chosen to do with respect to their business and the business decisions they make. I can comment with regard to Genworth and our experience in long-term care insurance. And that last slide is something we've been using to address the issue with regard to rates. I asked our folks, in Richmond with regard to, what's our current statement? How are we explaining what it is we do? There's actually a good news story in the rate issue, which is that people keep their long-term care insurance policies. For anybody who's been an observer of this industry for a long time, you know that rates were predicated on people dropping their policies. And that what we've learned, and learned this very well over the last 10 years, is the lapse rates on these policies, which we assumed would be 4, 5, or 6%, are less than 1%. Our current experience model and our rate filings, we're confident in reflect not just the experience with regard to lapses, but also reflect experience with regard to lower interest rates. So, we're not going to say we're better or worse than anybody else. We're willing to talk about what it is we're doing and how we're incorporating that into our products and our pricing today.
I'm Dan Axton. I'm an editorial writer at Newsday. Do you know, thank you, maybe Mark, can you tell us what is done in comparable other countries, such as Japan or Europe, other industrialized countries, about the problem of long-term care?
Yeah, I'm not really an expert on international long-term care. Some would say I'm not an expert on New York State long-term care. But no, I can't answer that question. We can provide to you some, source material or something and get some different information to you if that's, we can talk offline. I don't know if you know anything about that.
We've actually taken a look at Japan and at a number of European countries. France and Germany have probably done more on this than others. The proponents of the Class Act like to point to the German model and say that was sort of the basis for class, but I don't think the German model is a voluntary model. I think what you've got in Germany, if I'm correct, is a base long-term care program that's a requirement. And we had some discussion in this country a few years ago as to whether we ought to include a long-term care benefit as part of Medicare, but it never really went off the ground. So I think what you've got in Germany is a base program, and then private insurance pays on top of that. And I think the French are similar, but I can't remember exactly the differences between the German and the French model.
Question? And I know I have a question I saw in the other room.
Hi, how you doing? My name is Steve Passman. I work in Center Client's office. There was one statistic I think Sam gave, this is actually for both people, that there's like 50 carriers who write this business in the country, and there's only 10 that write it in New York. And I was wondering if there's anything the state could do to either encourage those carriers that are currently admitted to write more policies, or to encourage other carriers to be admitted in New York.
Well, I mean, I would say, with all due respect to our colleagues in the insurance department, it is a tough department to get through for new providers. I mean, it is such because we have a strong ethic to on consumer protection in the state. So it's hard. It's not an easy business to be in New York, and the people over there, do their job very well.
Yeah, Steve, what I would encourage the state to do is to get some facts around this from a perspective. To go out and ask some of the carriers who are in other states who write long-term care and don't write it in New York, and find out what their reasons are. I mean I can tell you a guess, but I think you could probably get some pretty good answers because, as I said, for us, New York is a great marketplace for us. And that, I kind of look and scratch my head every time I look at the numbers. I was actually surprised that as few as 18 carriers were writing in the state. And I think that probably included Met and Hancock, which are not writing it anymore. So it's one of there are probably 16 carriers. But I would encourage the insurance committees or the insurance department or even the Department of Health or the partnership. I mean, the partnership provided a really good forum for bringing people around the table. Perhaps the state ought to, reconvene a meeting of, non-participating carriers in the partnership and say, look, why are only 4 of you, there are 18 licensed carriers or 16 licensed carriers, why are only 4 of you writing in the partnership program? And then, bring in some of the carriers who don't write in the state and ask them. I wouldn't do it as, an inquisition or a public hearing. But I would do it, more informally. I mean, somebody convene an informal meeting and ask some of the carriers to come in and ask them these questions.
I would just amplify on what Sam said. The other thing that I think maybe didn't come through in the presentations is that the fact that the governance of the partnership really is a partnership. I mean, it really is a public-private board that's set up that meets quarterly, hopefully, as much as we can quarterly, to go through the mechanics of how this program is implemented. And it's somewhat unique that we have people are at the table making decisions about the implementation of the program.
Hi, I'm Ginger Landy. We represent the New York State Federation of Assisted Living Providers. And I was just curious, the breakdown on your claims paid in New York State, the 69% home care, 16% assisted living, and 15% nursing home. Is that indicative of other states as well? Is that pretty much the same ratio?
Yeah,
across
that
the
is
country?
consistent. Because I went out and asked our claims people last week, give me your latest data, and the New York numbers were pretty much consistent with the national data. So, yeah, I mean, again, we thought we were writing nursing home insurance. No one ever says, I want to go to a nursing home. Everyone always says, I want to stay home, and it's like, here's a mechanism that enables you to do that.
John Shaw from Next Wave in Albany, and I had a quick question first and then a follow on to that. You talked about the plans that are coupled to annuities and life insurance. What % of total long-term care insurance is in that category?
Well, let's start with, Genworth experience in New York, and on the annuity link, 0, because we have not been able to get that product approved by the state insurance department. So that goes back to Mark's answer. That's something else.
I suspected that it was somewhere in that range.
Yeah.
And one of the things, this whole concept was raised at the annual Academy of Health Services Researchers meeting, and raised a number of nuances that appear to be addressing issues. By coupling the long-term care with life insurance or annuities, you get some other benefits of looking at transfer of assets as a whole picture, because you're trading off existing assets and protecting some of them if you're spending for long-term care and so on. And perhaps one of the biggest issues is it helps address the elephant in the living room. Everyone's in denial and doesn't want to think about or talk about end of life or disability towards the end of life. So in healthcare, we always couple mortality and morbidity when we talk about things that we want to avoid. This could be a way to bring the message forward to the general public, because I don't hear about any of this in the popular press. So people do buy life insurance. And so if they are buying end-of-life insurance that includes long-term care, that might be a way to address the denial as well.
Yeah, yes, everything you've just said is valid. That when we met with the Ways and Means Committee back in 2005 and 2006 discussing the Pension Protection Act, they said, what can we do to help you? And we said, well, one of the issues is that we continuously get an objective of, well, I paid all this money on a long-term care insurance policy. If I don't use it, then I paid all this money in the policy. And our perspective as an insurance company, well, you do that with fire insurance or auto insurance, but that didn't work for the consumer. So that from the perspective of you, as you described, that there is some benefit, that whether you use the long-term care benefit and deny whether you're going to use it or not is irrelevant, because you will get the life benefit or you will get the payoff from the annuity. So yes, we completely agree with you on that.
That was 5 years ago?
Yeah.
Okay.
I think we have time for one more question. Let's see. Oh, I do see one.
Tom Gage, Rockefeller Institute. This is speculative, but I don't think too speculative. The data about the Alzheimer's was sort of striking. I wonder what the public policy response might be, however, if in the not-too-distant future we have tests that indicate high probability or predictability of Alzheimer's. It would seem to undermine the insurance model pretty severely if we have that, if that's if the tests were good.
You know, that's a very interesting question that we've been dealing with for probably the last 15 years, that we have found that that question started being posed with regard to insurance underwriting and employment and in I can't remember the bill, Louise Slaughter's bill that was signed into law, Genetic Information Non-Discrimination Act. It addressed that issue with regard to insurance and employment and non-discrimination. There's some question today as to whether that applies to long-term care insurance. From the science perspective, it hasn't. We haven't seen any progress that actually shows a genetic linkage. Lots of people speculate, but we haven't seen any. So that for now, it's an issue that, yes, we're well aware of. Should it happen and Gina apply to us and people have information about their genetics, I think our approach would be to say, look, if you've had a genetic test, we would need to know about it, because underwriting needs to be a fair game. We need to know what your genetic test showed. And I think that what would happen would be we would have to price for that accordingly. So I don't think it'd put us out of business, but we were very conscious of making sure that the law and the regulation doesn't get ahead of the science here. And so far, there's been a lot more speculation than there has actual fact and science results on that.
Well, that was certainly an interesting last question, and I know these issues are going to be around for a long time, so I'm feeling we might have you back at some point in the future. And I am curious, Mark, to see if this was part of the 2012 presidential campaign or not. But please join me once again in thanking our speakers.